Welcome to today's presentation. I'm Dr. Joe Troiani, consultant to the Riverside Township Mental Health Board. Prior to that, I was a member of the board for a couple of years and a 27-year resident of Riverside. I welcome all of you today to today's forum, and I would like to start off by inviting our Township Supervisor to share a few words with those of you watching as well as those of you who are here.
Hello, my name is Adam Wilt. I am the president of the Riverside Township Mental Health Board. I am very proud to welcome all of you and really to be celebrating 50 years of a wonderful, wonderful entity here in the township that's sometimes overlooked and sometimes missed. And so today we're really trying to focus our program on helping to make sure the residents of Riverside Township understand what resources are out there and how the Mental Health Board can help support the residents of our community. I personally have been a resident of Riverside Township for 31 years, and I have professionally been working for an organization called Best Buddies, where we work with people with intellectual and developmental disabilities. And really the scope of the Mental Health Board doesn't just provide support for mental health, but it does provide support, and the purview includes people with disabilities and a lot of other services that we're really excited to be able to highlight today and to really be able to focus on what the Riverside Township residents need and making sure that everyone's very well aware of those. So we're very excited for that, and I want to turn it over to our Riverside Township Supervisor, who can tell a little bit more about the township and some of the services that work in conjunction with the Mental Health Board. So thank you.
Good afternoon. My name is Vera Wilt, and I'm the Township Supervisor of Riverside Township. I welcome you all to this event, and I'm very pleased that so many of you did show up today. We never know how many people are going to come out. When you talk about not always aware of what's going on in terms of even knowing that we have a mental health board, township government is a lot like that. People don't even know that we're here or how we differ from the village. Township government focuses mostly on the social services. So besides the community having recognized the need for a mental health board 50 years ago through a referendum, the township also provides things like general assistance for those who are between work or waiting for disability, and other circumstances may put you in there. We have emergency assistance that is, if we can help you with the amount that we have and other resources, we can get you out of a health and welfare threatening position. Sometimes that may be an eviction, it may be the turnoff of utilities, things like that. We provide a food pantry, we provide a nurse's closet, and we have been cooperating with the Mental Health Board on one of the services that you're going to hear about today, and that is the Community Resource Center. So it's housed right here in the town hall. The town hall is also a jewel of the community, which is available for community groups and individuals for use. And so the Mental Health Board and the township work hand in hand. Right now, I'm getting ready to appoint some new members to the Mental Health Board, and I really appreciate all the services that they have recognized are needed, the surveys that they've done to find out what is needed, and I would ask all of you, whether you're here in the room or watching this later, to try to spread the word or learn more about what the Mental Health Board is doing in this community, as well as the township. So with that, I'm not going to waste your time anymore and let the program begin.
Thank you. Today, you'll have the opportunity to hear from the various representatives of the agencies that serve Riverside Township, and at the end of which we'll have a special presentation. I wanted to take a little bit of time talking about mental health, DD services, and generally behavioral health services in the state of Illinois and especially in our area. If we go back to the turn of the century, the beginning of the 20th century, the primary focus of services were institutionalization. Men and women who are experiencing a range of behavioral health services were institutionalized. We had such institutions as the Joseph P. Kennedy School, which no longer exists, as well as the state hospitals. I'm old enough to remember we had facilities such as Manteno State Psychiatric Hospital, which is no longer, had a population between 26 and 28,000. We had Chicago State Hospital up on the northwest side of Chicago, an area where I grew up, which had a population of about 8,000. And then we had Elgin Hospital, which is still around. It's a forensic unit, but they had a population of close to 10,000. This was a period of time, yes, we did not have psychiatric medication. We had some experimental methods of treatment, everything from ECT, electroconvulsive treatment, to insulin shock treatment, and hydrotherapy, just to mention a few. But it was a period of time where a person living with, experiencing any behavioral health problem, more than likely they were institutionalized. And the probability of moving out of that institution was very remote, primarily because services weren't available. Services weren't funded, and to a greater extent, they were non-existing. Well, that all started to change in 1963. We had the passage of the Comprehensive Community Mental Health Act of 1963. It also promoted a program of deinstitutionalization and allowing individuals to work, live, and thrive within the community. We saw the phasing out of those very gray institutions, Manteno, Chicago State, and Elgin, and replaced by places like Madden Mental Health Center, right by Loyola, Reid Mental Health Center up on the northwest side, and we had Tinley Park up until recently. It was closed. And the focus was the establishment of hospitals to provide short-term hospitalization, after which an individual was returned to the community. When individuals were returned to the community, we also started to see the funding of community mental health centers. In fact, one of the first community mental health centers that was funded in 1963 was actually Northwestern University, a community mental health center that until a couple of decades ago was located right by the Newberry Library, as well as some of the counties. Now, like with any good intention program, the funding was not quite adequate. In fact, most of our agencies here had to operate at a deficit. That is, the funding that came in did not meet the need for revenue to keep the operation going. That's why they're very involved in their own fundraising, development of foundations. But a few years later, in 1972, we saw the establishment of 708 boards. Now, often I get the question, why are they called 708 boards? Well, again, looking around, most of us remember that there were two area codes, 312, which was Chicago, right? Everything out of Chicago was 708. Until you went downstate, it was 815. Now, it's kind of interesting because in the past year to 2 years, there's been a flurry of referendums establishing 708 boards. In fact, I've been at some meetings where people are talking about this is a new thing that has come along. And I'm always proud to raise my hand and say, oh yeah, I live in an area where there's a 708 board. And by the way, they've been around 50 years. And I've had the questions, you mean 708 boards have been around for 50 years? I said, yeah. But the good news is with the referendums that are out there in the last election, all but one passed. and we had countywide referendums. And the good news that I could report is this is establishing a new revenue source for investment in community mental health and behavioral health across the entire spectrum in those communities, just as we've had the benefit of funding here in the Riverside Township community. But imagine that 50 years ago, which really puts us on the cutting edge in many ways. But the cutting edge continues. In the last few years, there have been a number of innovations that have been brought to the Mental Health Board, discussed by the Mental Health Board, and a decision in a collaborative way made to go ahead with that funding. Yes, we do fund the agencies. Our funding is supplemental. It's very important in helping with that gap between funding they receive to provide the services versus the cost. And there's, ladies and gentlemen, there's quite a gap there. And again, the 708 Board, Riverside Township helps to fill that gap. But it also affords us the opportunity. We meet monthly with the exception of July and August and the month of December. At that meeting, the board is exposed to information and literature and reports regarding trends, new things that are coming up, and issues that we need addressing. As a result of this, a number of things have occurred. For example, we have a text line for teens called Support for You. Now, any of you who have teenagers or even millennial adults like my wife and I do, they don't talk by phone anymore. They do text. And that has been absolutely fabulous because kids who might not pick up the phone will text. And we get quite a volume of calls that come in versus the text line. So this is a way of reaching out to those teens that are distressed, and all you have to do is pick up a newspaper today to look at the severe mental health problems that we're having with kids because of COVID, or more importantly, because of the 2-year shutdown of the school system. Even the New York Times had an extensive article regarding that. And I mention that because that's one of the things that the board does. Look at studies, look at what's being reported, and ask the question of what relevance is that to Riverside Township. Also, 2 years ago, we established CIT training for officers. CIT is Crisis Intervention Team. The course is a 40-hour course offered through various organizations established by the Law Enforcement Training Standards Board out of the University of Illinois, Champaign. There's a 40-hour course that trains officers to become certified as CIT specialists. They are given training in how to handle behavioral health cases that come up on the streets. And we had the opportunity to offer 2 training sessions, one this year, one last year. And instead of having 1 or 2 officers in a department that are trained in this, I'm happy to report that if I remember correctly, for example, the Riverside Police Department, their entire police department are CIT trained. And likewise with Brookfield, and as well as North Riverside, they have officers on each shift that are be able to be called out in the event of a mental health emergency. And this is critical that is having the CIT program in place because, as you all know, we now have a new crisis number called 988. And when somebody calls 988, if they need to have an intervention, the program called 590, called the Crisis Response Teams, which is carried out by pillars in our community, will respond to the emergency, as well as law enforcement. Next year, July 1, there will be the new interface between 911 and 988. A call will come in to 911 if it's determined it's a mental health emergency it'll be lateral transferred to 988, and 988 could then get the resource in that area to respond, in addition to if there's a need for first responders. Now, we've been doing this for 2 years. We are now starting to get calls from other areas about, I hear you guys are doing CIT training, and it's a collaborative. How are you doing it? How is it working? And I had the pleasure of briefing law enforcement and 988 partners regarding the CIT. So I'm proud to say what we've established will probably be the model for the state of Illinois eventually, to bring that collaboration between individuals experiencing the problem, the first responder community, as well as us providers. We also, at the request, had the opportunity as a board to fund a police social worker. We were able to provide funding for a police social worker who's able to do the follow-up on those calls that engage our first responders, that in fact need follow-up. And that's a very important piece in the whole crisis response program. We also have established a community resource center here in the township building that provides resources and information on resources, and you'll be hearing more about it for those who are residents of Riverside Township. Now, we do have people out of the township coming. They hear about some of the good stuff that's being done here, and that's okay, because they're helped and they're also served. But in the development of the CRC space and materials and office, we also have created a resource guide. And this is important. Law enforcement has copies of this guide. First responders have copies of this guide. They're able to call up that information on their computers. They also have copies to give to an individual who might be requesting additional assistance. So in many ways, our first responders have also become our outreach workers. What's really exciting to see is when training takes place and reviewing the comments, we hear things from our police officers and our other first responders that this is some of the best training that they've experienced. Other comments like, these tools are so helpful. We even had a few get back to us a month later and say, you know that stuff you were teaching me? I had an opportunity to use it. Just to give you an idea of the value of this type of training. And also, I want to mention Riverside TV. Through the efforts of Riverside TV, we've done a number of programs. The most recent program, which was done last year, was on veterans. These are programs that are taped, such as our taping today. They will then be edited and then made available and also put on our website. So it's an opportunity for people to get information regarding what we're doing, or as well as the topic. And I'm especially pleased to see that we're addressing veterans. I myself, I'm a retired United States Naval officer, served 32 and a half years, and been concerned about services for veterans in our community. And I'm glad to say our agencies are taking heed of that, and we had the opportunity, in collaboration with Way Back In, the Vet Center here on Harlem Avenue, as well as Hines VA, to do a marvelous program addressing the needs of veterans. What I'd like to do now is turn it over to our representatives from the various agencies. First up will be a representative who is from Way Back In, but we'll be talking about our Community Resource Center, Aging Care Connections, and Way Back In. So we give you more than 5 minutes.
I appreciate that.
So let me go ahead and turn it over to you. You got easily 10 minutes, if not more.
I'll see what I can do. Thank you so much, Troiani. So my name is Jillian Reid, and as I was introduced, I am a representative for Way Back In, and I will be speaking on behalf of our partner, Aging Care Connections. But off the jump, I would like to touch on the Community Resource Center that is available here, as was stated in the Riverside Township Village Hall building on the first floor. So what we do is provide guidance and referrals for individuals within the township that are in need of assistance in regards to substance use and mental health issues, aging, disability. We have Medicare benefits counseling available by appointment. And we just largely are here as a resource for anybody in need to find information that they're not quite sure how to track that down themselves. We've helped with dental work. We've helped locate other agencies to help individuals who were unloading a large amount of items from I don't want to say a hoarding situation, but there was a house that needed to be basically unloaded, and we helped find locations for all those items to be donated. So we are here. It is staffed by the 3 separate agencies, Way Back In, Aging Care Connections, and UCP Seguin. So with that, I would like to kick off talking about Aging Care Connections. So their staff link older adults to benefits and services that enable individuals 60 and over to remain independent and in the community for as long as possible. For example, ACC assists older adults with accessing in-home services, caregiver support services, home-delivered meals, and transportation, as well as providing Medicare and Medicaid assistance. In addition, through the Adult Protective Services Program, staff investigates reports of abuse and exploitation of older adults and adults with disabilities. Lastly, Aging Care Connections' Aging Well Neighborhood Program brings together older adults, businesses, and healthcare and social services to create a health neighborhood that promotes lifelong wellness, supports aging at home, addresses chronic conditions, offers health education, and helps build an age-friendly community in Greater Lyons Township. The Well Neighborhood Program includes evidence-based health workshops, expert speakers, preventative screenings, support groups, and healthy choices information. Each year, their staff assists more than 9,000 older adults and their families with accessing services. They provide services to older adults and their families in the following service areas: Leiden Township, Lyons Township, Norwood Park Township, Proviso Township, and of course, Riverside Township. Now, the way that the Riverside Township Mental Health Board has supported their work and helped their agencies serve Riverside Township in particular is by ensuring needed services are readily available to Riverside Township residents, specifically by recognizing that mental health services are needed in every community. The Mental Health Board helps to promote efforts that reduce the stigma that affects Riverside Township residents who are impacted by mental health issues, substance abuse, and/or are living with developmental disabilities. Pardon me for that. And with that, if it's okay, talk about Way Back In.
Way Back In.
Don't need my phone for that. I'm just kidding. So Way Back In is similarly celebrating 50 years of establishment. We opened in 1973 in Maywood, the oldest house in Maywood. Our partner organization was Grateful House, which recently celebrated 65 years. And then in 2002, after working separately but collaboratively for about 30 years, those organizations merged under the name Way Back In. So what we do is we offer extended residential treatment for individuals 18 and up who are suffering from alcohol, substance, and gambling use disorders. In addition to that, we also have our outpatient youth programming. And with that, we have been invited into local schools and local teen club type of situations to talk with teens about the dangers and hazards of vaping substances, trying to kind of nip it in the bud before it becomes an issue. I want to thank Joe for bringing up our veterans program, which we did talk about last time we were on Riverside TV. Our veterans program through the Hines VA is a completely free program for veterans that are in conjunction with the Hines VA. They come and stay in our facilities, which are basically homes in the neighborhood. You would, driving down the street, not know that you're looking at what you're looking at. So they come and stay with us, and it is free of cost to them. They can stay with us as veterans, or if needed, they can be treated as well for any substance use or gambling issues they may have. On top of that, we have also been spearheading the award-winning Are You Really Winning campaign, which is through IDHS and Super, and that is a statewide campaign discussing the effects of gambling, which is highly problematic if it gets to that point. So we're very proud of the work with that. And our gambling program, not because of this statewide campaign, but we are able to treat statewide because that is largely done via telehealth. So people don't necessarily need to come to Way Back In to get those services. They just need to have access to a phone or internet, which is great because we are accessible. I think that about
Great.
wraps it up.
One of the things I was to mention, the board has been paying very close attention to the drug trends. And it was 3 years ago, our first Riverside TV program focused in on marijuana. So 3 years ago, we started seeing some of the reports that were coming out, which now have been verified and amplified and at a crisis level. And that is a 300% increase in youth presenting to emergency rooms with schizoid or schizophrenic-like reactions that are attributed to their marijuana use. Now, marijuana is medically available, and yes, it's also available recreationally. And, you know, of course, like alcohol, kids are able to get access to it. And they're getting access to marijuana, which the Illinois Medical Society and the Illinois Psychiatric Society has basically said this is pretty dangerous. So we've done a lot to get the word out there. And again, that's something the board does. It was on our early warning radar screen, and we went ahead and addressed that. But thank you for your presentation on all three.
Thank you, Joe.
And there's a question. How has funding or support from the Riverside Township Mental Health Board been of importance with these projects and agencies?
They've been vital. They've been crucial. I know that we have been being funded by the Mental Health Board since 2018, and in 2019 is when we started our partnership with the CRC and staffing that. And pardon me, with the funding, we have been able to help specifically Riverside residents. We average about 10 to 15 per year from Riverside specifically. And again, just the connection, the collaboration, and the working together with the Township Health Board has been crucial, and we greatly appreciate your guys' support.
You know, again, we saw a need, the board saw a need, and the recipients of funding came together and hammered out a plan and launched it, had to do some tweaking along the way, or as we say, the shakedown cruise. And we have what we have, which is a valuable resource here in Riverside.
Yes.
Thank you very much.
Thank you very much.
Our next presentation is a representative from UCP Seguin. So Jim, if I could have you introduce yourself and take it from there.
Yeah, thank you, Joe. Hello, everyone. I'm Jim Haptonstahl. I'm the Vice President of Institutional Giving for UCP Seguin of Greater Chicago. That's United Cerebral Palsy Seguin of Greater Chicago. It's a combination of two agencies that merged 10 years ago, United Cerebral Palsy Association of Chicago and Seguin Services that you might have known us as primarily in the Riverside community. We're glad to say it's been a very fruitful partnership and merger. We provide UCP Seguin for short, a wide array of essential, innovative services to persons with intellectual and developmental disabilities, people with Down syndrome, with autism, with other intellectual or cognitive disabilities. It could include people with cerebral palsy who have some functional disabling conditions as well. It's from birth to old age. Our services span across more than 85 communities in the Chicagoland area, as well as Illinois and 4 other states, enabling children and adults with disabilities to achieve their potential, advance their independence, and act as full members of the community. And we offer residential services to adults with developmental disabilities in multiple small community-based homes, including 3 group homes in Riverside Township, 2 in Riverside and 1 in North Riverside. We provide respite and other in-home supports to individuals and their families. We bring fun into their lives through social and recreational services. We look out for the physical and psychological well-being through our innovative clinical services. We place and support individuals, including Riverside Township residents, in community jobs throughout the greater Chicago area, including in our own social enterprises. Seguin Auto Center, where you can get your car washed, by the way, over 31st Central, Ogden. Great car wash, bumper to bumper to the basics. And Seguin Gardens and Gifts, a greenhouse, fully appointed greenhouse, and a beautiful gift shop. It's open today if you want to do your holiday shopping and for the rest of the season. It's a great place to go, and it employs people with developmental disabilities. Through our community day services, we provide life skills training, enrichment activities in the community, including volunteer opportunities. UCP Seguin provides nurturing foster homes to children and adolescents, including specialized care for children with behavior or medical challenges. In addition, our Infinitech program provides assistive technology, training, equipment, and access to specialists and resources to schools in 5 states. I believe some Riverside Brookfield High School utilizes Infinitech's capabilities and services. For decades, the Riverside Township Mental Health Board has been an integral partner with UCP Seguin in delivery of essential services to Riverside Township residents with developmental disabilities. In particular, funding from the Mental Health Board has supported our community employment and day services and our involvement in the 3-agency Community Resource Center partnership, enabling Riverside Township residents to fulfill our mission, life without limits for people with disabilities. We at UCP Seguin are pleased, very pleased, to celebrate the Mental Health Board's 50th anniversary and look forward to the next 50 years and beyond. Thank you.
Thank you very much. Same question. How has the Riverside Township Mental Health Board been of support to UCP Seguin?
As I mentioned, Joe, the main way that the Riverside Township Mental Health Board has supported us is to help us provide community employment and community day services, life skills training services to residents with developmental disabilities in Riverside Township. And that's been essential to fill the gap that Joe very appropriately described. What we get from the state does not cover all the costs of those services. Without Riverside Township support, we wouldn't be able to do what we're doing. So we're very grateful for that. Thank you.
Thank you. Next, we're going to hear from a representative from CSS who is new to attending our board meetings. So first of all, welcome.
Thank you.
And we're putting you on the spot.
Hello, everyone. My name is Yvette Williams. I am the Vice President at Community Support Services, also known as CSS. So, tell you a little bit, as Joe indicated, I've been new to the CSS and the Riverside Mental Health Board, but it has been an eye-opening experience. It's given me an opportunity to work in a different arena, and what I'm learning from our participants is just amazing. And at CSS, we take the opportunity to provide our participants with a hand up and not a handout. Let me tell you a little bit about CSS. CSS Support Services is a private, nonprofit agency that initiates, provides, and promotes services for people with intellectual and developmental disabilities and their families to be a part of their own communities. CSS serves children, adults, and seniors diagnosed with intellectual and developmental disabilities. We provide the following services: case management. We have a great staff of individuals who actually take the time to provide resources and the things that are necessary for our participants. We have respite service. Respite provides an important break for parents and their caregivers. CSS is one of Illinois' largest respite providers. Respite services may be provided in the family's home or in our community and can take place in one-on-one settings or in group settings. Community day services is a fresh approach to traditional day programming where activities are planned with participants. We offer classes in health, art. We're starting a new class in our Brookfield office, drumming. So anybody want to come and take some aggression out, we're going to start drumming. And we're offering it to our staff as well to help with that. So we offer development job skills. Each participant in our program works with a job coach. We have a home-based support services. We offer self-directed assistance and group respite options for individuals. We also have our residential and independent living services. CSS owns 8 group homes, which we have individuals, the amount of individuals are anywhere from 4 to 6 bedrooms in that home. Our participants have a different interests, goals, and needs. So the resources and supportive services we provide are tailored to each individual and their families. Thank you. And we continue to thank the Mental Health Board for their support of community support services.
Good, thank you. And again, welcome to our board meetings.
Thank you.
And look forward to working with you. The next organization is NAMI, but I'd like to say a few words regarding NAMI. Most of my career, I ran substance abuse programs. In 1990, I ran psychiatric hospitals for 4 years before going into public health, where I ran behavioral health for Will County. And one of the things that I observed is the growing importance and role that NAMI has. Granted, when I came in, we heard of NAMI, didn't see much out in our county. There was an absence of the presence of NAMI. But in the last 10 to 15 years, NAMI has grown phenomenally. NAMI is very involved in some of the policy-making bodies regarding behavioral health in the state of Illinois, and that includes the Mental Health Summit. That also includes Mental Health America of Illinois. And they have become a force for behavioral health in Illinois, which is absolutely critical. The programs that NAMI's develop are absolutely phenomenal. I remember in 1990, when I was working in mental health, I says, gee, you know, in alcohol and drug treatment, we have Al-Anon, Allotine. We had all these support programs. And at the time, we didn't on the mental health side. So again, congratulations to NAMI and the work that they're doing and the continued expansion of their influence and their support in the area. So I've got a representative from NAMI, and I'll turn it over to you. And thank you for being here.
Thanks, Joe. My name is Cait Joycesmith. I'm the Director of Advancement for NAMI Metro Suburban. I'm also a social worker, and I'm really honored to do this work alongside NAMI Metro Suburban. NAMI, as Joe mentioned, stands for the National Alliance on Mental Illness, and NAMI Metro Suburban is a local affiliate of Greater National NAMI. We are West Suburban Cook County's place for community mental health, and our message is that mental health is health. We all have it in some way, shape, or form, and that anyone who may be struggling with their mental health is never alone. This is incredibly poignant for many folks who are struggling, who do struggle, and who need that reminder of hope. We were founded 30 years ago, and we were founded by parents, by mothers who would often meet in between visits of their adult children's visits to psychiatric hospitals. And it was their desire to have community and connection, not only for their children, but for themselves, to be able to offer more support for their children. That founded our drop-in center, which over 30 years ago still stands. And we now have grown since those 30 years to offer comprehensive services for not only individuals, families, and the greater community. Our individual programs include our 3 living rooms, which are direct support for those who may be in crisis, to receive support, to receive tools, to stabilize from crisis as an alternative to the ER for those who it may be a good fit for. We offer a host of other programs to support folks in their mental health recovery. So that's a jobs and employment program for folks looking for gainful employment, for regular connection and community support groups, as well as those for loved ones impacted by mental health. So we offer a number of family programming as well. Something that makes NAMI unique is that we are staffed by those who have an experience of mental health in their own lives or that of a loved one. And so when we say you're not alone, we really get it. We really understand it because we've lived it. And so we not only are there supporting folks in our community, Riverside Township and beyond, with tools, support, and understanding, but also hope that's really enacted each and every day at our locations and with our staff people. We offer a lot of preventative education as well in not only the community at large, but in schools. So we're in middle and high schools offering stigma-reducing, myth-busting, help-increasing programs that really get the conversation going for young people to really get the support they need. And for folks through our mental health first aid program, for example, to train adults who may be working with those young people to really identify and connect them to support as they need it. We are really excited to be now offering, in conjunction with Pillars Community Health, who you'll hear from soon, our Loft at 8 Corners, which is a teen space for mental health. It's all the services, whether one-on-one, whether group support, drop-in, are at no cost to residents. No insurance is required, and they're completely free in nature. No appointments needed. So I imagine they might touch on this too in the soon-coming discussion on Pillars Community Health. And that's, the real message that we promote, of course, among our programs and services, in particular, those supported by Riverside Township Community Health Board, is that we are here ready and able to offer support as needed. One of the ways that Riverside Township Community Health Board has deeply enhanced our ability to reach young people is through the Support for You Teen text line. So as Joe mentioned, this text line is available 24/7 for area teens to be able to text in a code on their cell phone saying, with a code that says that they're stressed, they're overwhelmed, they're struggling, and offers immediate connection to support on the phone. We've had some instances of immediate crisis diversion and ongoing support that text line offers, and it's from the support of Riverside Township Community Health Board that we're able to offer that program. We've also been supported, NAMI Metro Suburban has been supported through mental health first aid training for first responders. So as you may know, first responders are oftentimes the first place of interface for those in crisis. And so we've had the opportunity through funding of Riverside Township Mental Health Board to offer this critical training to folks, in addition to the CIT training, tools for helping folks who might be in crisis. Lastly, I'd like to say, in gratitude, of course, to Riverside Township Mental Health Board in celebrating such a monumentous 50 years of support for mental health in our community, is that it has also acted as a convener for all of the many folks here and the agencies represented, and doubled, tripled, quadrupled the ways we're making a difference in our community. So thank you on behalf of NAMI Metro Suburban, on behalf of all those we serve, and the difference you help us to make. We are very grateful.
Good. Thank you. One of the comments I wanted to make, and this is a testament to some of the innovation that we're seeing, the living room concept. Now, I grew up in Chicago. I still call it the front room, so bear with me. It took me a while to switch from the front room, and oh, no, you mean the living room. The living room concept is very innovative, and in fact, this past summer, The state acknowledged the importance of the living rooms and funded 28 new sites statewide. And I think you were the first ones to roll out the loft, which is the living room for teens.
Well, as I know our friends at Pillars Community Health will soon share, while it definitely served as an inspiration to the loft at Eight Corners, in that it's a concept of walk-in, of availability of accessible support as the community needs it. It really took on its own interdisciplinary model in conjunction with Pillars Community Health, which I'm sure they'll speak to. But yes, it is the living room concept itself is an incredible innovation that allows immediate access to support without the necessity for emergency room. Yeah. And so thank you for uplifting that. And we're expanding our hours, and we're really excited to be opening to even more hours of 24/7 in the coming year. So we're really looking forward to that.
Good. Next, we're going to hear from a representative from WSSR.
Hi. How's everyone out there doing? I'm Marianne Birko. I'm the Executive Director with West Suburban Special Recreation Association. We provide year-round recreation opportunities for children through adults with disabilities. How many people here gathered with friends and family during Thanksgiving holiday? Great. How many people here like to enjoy music, gatherings? How many people here like to go out in nature and walk? There you go. Those are all the things that we like to do, and we provide in services for children through adults with disabilities. It is critical to all of our mental health to be able to access those kinds of services. Oftentimes, people with disabilities don't have that immediately at their fingertips. And so we are a resource for that to happen. I want to honor and thank the village of Riverside, because they took a big step and joined the West Suburban Special Recreation Association in 2018. And we've been able to provide these services for your community residents as a result of that. As an agency, we have existed for 47 years. Providing these services. We have 12 partners throughout this area. We go as far north as Franklin Park and go as far south as Berwyn and Riverside. So anyone with a disability who lives in Riverside of any age or ability is eligible for our services. And again, all ages, all abilities. We've heard from a large group of people up here who are promoting the support of individuals with mental health issues, but really it's any one of us at any point in time could encounter a crisis, and we want to be there to support them. So I think it's one of the very few communities of our 12 communities where this board is as active as it is. So I applaud you for all of your work. Our focus in our recreation programs is for age-appropriate designed activities. We offer a variety of programs, as I mentioned, a variety of things and activities that each and every one of us like to do. We try and promote in the services that we provide. They're year-round. We have an emphasis of programming after school, in the evenings, and on weekends when most people have time available to recreate. Through our programming, we foster social development, create opportunities for new friendships. We increase self-esteem. We improve fitness. We foster independence. We help participants develop new skills, experience success, but most importantly, opportunities to have fun. But all of this would not be possible without the support of staff. And it hasn't been mentioned here, and I'll just take the global stand on it. Probably the biggest challenge we have every single day is staffing support. So anyone here who knows of someone who has a few hours during the course of any given week who'd like to dedicate some time in supporting services like this, and any one of us, we're all hiring. So those opportunities do exist. I have a table back there in the corner and available materials for all of you. I'll take advantage of the commercial and let you know that we hire both volunteers and paid staff positions. In the summer months, we offer day camp programs, and our day camp, at that time of year, we hire between 75 and 100 staff. This past summer, our biggest challenge was we had 30 individuals on a wait list that did not get to join in and be a part of these activities, which are so critical for respite for our families as well. And that was because of a shortage of staffing. So if anyone knows anyone 15 years and older, they can get off their phone for a few hours and then join in our activities. So please consider that. I've mentioned a variety of programs. We also do Special Olympic training programs and day camps. We hire in all of those positions. Thank you, Joe.
Good. Thank you very much. Next, we have a representative from Helping Hand.
Hi, everybody. I am Erica Bavrick, and I am the Vice President of Advancement over at Helping Hand. And we support over 700 adults and children with developmental disabilities in the area. Our mission is to transform the lives of all connected through genuine care and education. We have two large facilities. One is in Countryside that houses our school, which partners with over 30 other school districts in the area to provide services to 78 kiddos who do not, who might need a little bit more support than they would get in a traditional special ed setting. We are really excited that we just opened up an elementary classroom, so now we're serving 3 to 4-year-olds in our newest space, and it is, we just had a grant come in for furnishing the space, and you guys, it's really, really cute. But we're excited to be able to serve more of the kids in the area. The Countryside location also houses our outpatient clinic, which serves over 200 kiddos in a variety of services. We have just started doing some hearing screenings, and we just launched a new feeding therapy to help some of our kiddos with texture issues and choking issues so that they could also enjoy food, which is incredibly important to all of us. We have also started new programs for some of our families, because having a child with a disability can also be a little bit of strain on families. So we are offering family support groups and sibling support groups, because there's also some strain that is involved with some of the siblings that are associated. We're really excited over at Countryside too, because we have been able to raise enough money to build a playground in our courtyard, which will be therapy for both our kiddos in the school and our kiddos in the clinic. And what we noticed is there were so many families that were waiting for services at the clinic that had siblings that were just kind of hanging out for 1 to 2 hours sometimes, because services are long. So those kiddos will be able to go out there and get some energy out, which hopefully will help relieve some stress on the parents, right? Everybody's tired when they leave therapy. We are excited that we have over 200 clients that receive services in our day program. And we are currently launching a new independent living program within our day program. Our day program is housed over in Hodgkins, and the independent living program means different things to different individuals. Sometimes independent living could just be parents leaving the client alone in the home for a couple hours, and on the other extreme, independent living means I want to live on my own in an apartment. So we are launching that program and using technology, which is really exciting, to give some independence to those individuals. So using smart homes, smart devices that will help remind individuals to take medicine, to shut off the running water, to make sure that the doors are locked. So using some of that innovative technology is really exciting. Our residential program, we have 12 homes currently in the surrounding area. We just are renovating 2 new homes, and we are looking at purchasing a 3rd home to meet the need of families that are contacting us for residential placement for their loved one. So exciting things happening there. Excited to be part of the community. And looking at what those homes are, you know, a couple of the homes may be a little bit more of a grace home where folks might just be looking for a quieter setting. And then some homes that are a little bit more accessible to the community, so maybe closer to the downtown area of Riverside or LaGrange or wherever we are, so that they could access public transportation and be more active in the community. I think we've got some folks right now that are handing out ornaments at, you know, one of the tree sales. We also have an employment program that helps clients get jobs out in the community, and we have over 80 individuals that are part of our employment program. And I'm trying to think, I think that this is all of our programs. We're also really excited. We're going to be launching a new kitchen initiative. We are building a teaching kitchen so that not only clients can learn how to cook, but sometimes, you know, when you become a direct support professional, you go from cooking for yourself to cooking for 8. And how do you do that while still maintaining healthy food initiatives? So we are excited that we are going to be launching that at our upcoming gala, and we will be using that for our transition high school students, for our adult day program clients, and then even some staff. So exciting things are happening, but we would not be able to do that without the support of Riverside Township and other funders, so thank you so much for that. Your generosity has helped provide 2,500 hours through the year through employment, our clinic, and our school. So thank you so much for all of that great support.
Good, good. And finally, Pillars, after which we're going to do a special presentation, but let me turn it over to Pillars.
Hi, good afternoon. I'm Ellen Kunkel. I am the Vice President of Grants and Government Relations for Pillars Community Health. You may know us by various names: Pillars Community Health, Pillars Community Services. If you go a little ways farther back, Community Care, Pillars and Community Nurse Health Center. Pillars Community Health is the result of the merger of a formalizing of a long-term, I would call a long-term dating relationship between 2 organizations that happened in 2018. So now we provide both physical and mental health services throughout Western Cook County. I do want to take a step back because I think that hearing and getting to go last, taking in really the significance of the formation of the Mental Health Board 50 years ago. I think that we all really have to applaud the citizens of Riverside Township for having that kind of foresight to do that 50 years ago, because none of us would be here being able to provide those services that we are providing to your community today. To have that formalized relationship, to really make sure that, you know, a portion of your tax dollars are really making sure that the local needs for mental health and developmental disability services are met. So I think that is no small feat. As Dr. Troiani said, that other areas, you know, see this as a new thing, and that you have had this for 50 years is really a testament to the strength of this community. What Pillars Community Health does, we have 3 lines of service. We are a community mental health center. We are a federally qualified health center that is medical and dental services, and we are also a domestic and sexual violence services provider. We run the Constance Morris House Shelter, which you may have heard of, as well as providing services. Our behavioral health services are really integrated through all of those lines of service, because we have seen that physical and mental health are absolutely intertwined. You cannot separate them, and we want to make sure that we are taking care of the bodies and minds of the people that we serve. We focus on the people in our area who may experience barriers to care. Those may be financial barriers, language barriers, cultural barriers, not knowing where to go and not knowing how to access services. So we really want to make sure that wherever people connect with us in the process, that they get the care that they need. That includes as I said, physical health through our health center services, including psychiatric care. So that goes from kids coming in for their well child visits, school physicals, adults addressing wellness issues, chronic care issues such as diabetes and hypertension, oral health care, which is often neglected in people who do not have the resources to access regular care. So those are all integrated. Those are primarily in our provided in our health center in downtown LaGrange. Our community mental health services have really been the crux of the Riverside Township involvement. As Dr. Troiani mentioned, we are the mobile crisis response provider in this area, meaning that our people are out in that moment of crisis to make sure that that immediate care is provided, that we're working with police, with emergency medical personnel when needed for those issues. We also provide substance use disorder services, which, as you know, is a critical part of mental health and behavioral health care, particularly in this area. And that's for all ages. That is for youth, adolescents, and our adults. Excuse me. Part of what we have seen too, and part of what the Mental Health Board allows us to do, is focus on our areas of expertise and work in our partnerships. Our partnership with the Loft at 8 Corners, forming the Loft at 8 Corners, really has been phenomenal. It's been a great model of care and really points to what we want to do, I think, across all of our agencies, is not only meet the needs that already exist, but also in education and prevention. We want to create that safe space for the teens to avoid the crisis situations, to avoid those more advanced behavioral health problems down the road by giving them the support that they need early on in that in their lives and in that process. New things that support from the township and from our other funders, it really allows us to look at what the growing and changing needs are in our area. Pillars Community Health this year is undertaking organizationally wide a suicide prevention framework, that we're looking at how we look at all of our services, all of the people we serve, and how we can educate and prevent suicides, which we see as an absolutely preventable condition in our area for all of those that we serve. We're also part of the West Cook Coalition. We are the behavioral health primary lead, working with Loyola Medicine and Care Advisors to look at social determinants of health in our area. Those are the other factors that feed into our physical and mental health. Does a person have housing? Or is there food insecurity? Looking at all those issues together and how they affect both the physical and mental health of the individuals. I'm going to pass it over to my colleague Julie to talk a little bit more about our Riverside connections.
Thanks, Ellen. Hi, I'm Julie Ryan, and I'm the Senior Vice President of External Affairs at Pillars Community Health. And we appreciate you inviting us to this activity. It's really a great way for us to celebrate. And the history nerd in me initially wanted to see how far back our relationship has been with Riverside Mental Health Board. And I know our computer system began in 1990, and it extends before that. So I don't know exactly what year it was, but I know that we've been working with each other from the very beginning, especially in crisis and bereavement services back in the day. At Pillars Community Health, we're very committed to Riverside and providing services in Riverside. Right now, we have a small health center clinic located on Burlington Avenue, and we provide services there Monday through Friday. We also purchased a larger building that is on Ogden Avenue, just west of Harlem, as a building that will probably in the near future serve some of our behavioral health needs, and so that kind of area there will be expanded, and more on that to come. We also work very closely with the Riverside Brookfield High School population. We actually have a counselor that is stationed at the school that students can use while they're on site, while they're at class, and make an appointment and come and see that person. So that's really important to us. And the other part of it that I think is interesting to show the deep connection that we have is we've had a surgence of individuals that live in Riverside that have recently joined our board of directors, which I think is very helpful in helping us to identify what are the needs that will be popping up here, and they can firsthand talk about what kind of the buzz is in the community. So we really appreciate getting their insights and anecdotal information that they have about the town. Because of that, we've decided that we are going to have some more activities in Riverside. So we had a trivia night that the board members from Riverside sponsored over at the beautiful Riverside Swim Club back at the end of October, and had a little fundraiser there and had some fun. We've joined the Riverside Chamber of Commerce, which we think is a great way to get to meet some more individuals in Riverside and hear firsthand what's happening and what their needs are. So we're hoping that as we integrate more into this area, we'll be able to even more better serve what the population really needs. And so we look forward to more years of working in this area and really responding to the needs of the people in the community. So we thank you for opening the door for us, really.
Thank you. You're welcome. Good. In summary, before we move on to our special presentation, this is more than just about a board coming up with funding. It's about cooperation, collaboration, planning, looking at the future, anticipating needs, and most important of all, responding to gaps in services and gaps in terms of needs that our community has. So again, all is to be applauded, the citizens of the township, the board, as well as the providers who are here. What we're going to do before we open it up to questions, I'm going to invite to the front of the stage members of the board, our president of the board, and if I could get our Township Supervisor for a special presentation.
The Board of Directors Honorary Resolution. Whereas Riverside Township Mental Health Board was formed to respond to the local mental health, substance use disorder, and developmental disability needs of Riverside Township residents as a result of the Community Mental Health Act introduced by Illinois House Bill 708. Whereas Riverside Township Mental Health Board has allocated grant funds to Pillars Community Health and its predecessor organizations and identified Pillars Community Health as a core agency to provide care for township residents. Whereas Riverside Township Mental Health Board has been a strong and consistent partner with Pillars Community Health in our shared commitment to providing local access to critically needed behavioral health services for Riverside Township residents. Be it therefore resolved that the Board of Directors of Pillars Community Health, on behalf of the organization, the staff, our patients, clients, and the community served, hereby duly honors the Riverside Township Mental Health Board on the occasion of the board's 50th anniversary of dedicated service, mission-driven compassion, and commitment to addressing the need for access to behavioral health care for Riverside Township residents. The board resolution was adopted by Pillars Community Health on November the 28th. I am pleased to present it to President Adam Wilt.
Thank you very much. And I just want to take a moment to say thank you to Pillars Community Health for this recognition in this resolution. Also, thank you to all of our agencies. I think it's just amazing to see how 50 years of Riverside Township Mental Health Board has really helped evolve the way that the approach towards mental health and disability services in the community continue to evolve and continue to be a resource for our community that I think our board, as well as a lot of the agency, all the agencies here, can be just so proud of the work that we're doing. We're doing it for our community, and so thank you to everyone for that. One other note before we go to questions, I want to give special thanks to Dr. Joseph Troiani. Dr. Joseph Troiani has done a great job of helping to inform and guide the work of the Mental Health Board. He is a resource as the consultant. He helps bring to light and make sure that we're aware of all of the trends in mental health, all of the changes, as you've heard today, but also have probably noticed in the news, things like 988, the Community Resource Center. These are a lot of things, a lot of new changes and trends when it comes to mental health, and Joe has really been at the forefront of helping make sure that the Riverside Township Mental Health Board is a leader in the mental health community. So thank you, Joe, for all of your efforts and for leading today's presentation.
If I may, not to prolong this, but I want to clarify, because sometimes it's confusing, Riverside, the village, and Riverside, the township. I want you to know that all of these agencies help way beyond the village of Riverside, and that the Mental Health Board actually serves all of the people from Harlem Avenue to 9th Avenue in a line going straight down, and from Cermak Road to 39th on the south boundary. So that includes an unincorporated area, a little piece of Lyons, and a little piece of Brookfield, and over half of North Riverside. So please know that you are all being helped and served, and that these agencies all serve even a wider audience. Thank you.
Again, thank you for the special presentation. I'd like to take this opportunity to open it up to questions from our audience here at the Riverside Township Hall. So, any questions or comments? Go ahead.
Yes, I do have one question for all of our panelists. You mentioned earlier, I know a couple of you mentioned how having representatives from all of the agencies that are here today has provided opportunities for you to connect and collaborate a bit. Would I be able to maybe ask if everyone could, if you have a example of some of the collaboration that's been fostered through the partnership with the Riverside Township Mental Health Board, that'd be great.
Good. So I'll repeat the question for our television audience. The question regarding collaboration and cooperation between the agencies, with the agencies coming together at the monthly meetings. And if you had any examples of how and where cooperation has taken place. And maybe we'll start at the opposite end and work our way this way.
West Suburban Special Recreation, I didn't thank the Township Board, but thank you for your support. Financially, all of our participants from the Township of Riverside can participate in recreation programs and receive a 50% discount on any programming, any services they use with WSSRA, with the exception of day camp and overnight trips. So that is a wonderful opportunity for the residents. As far as collaborating with this entire group, anytime we're together, we're informing one another of our services, and that in and of itself is a way of collaborating and making sure that any one of us who serve individuals can share additional opportunities for services.
I would just say that I know that our health center takes care of some residents and clients of Helping Hands, and so I know that I think dental and the health center, many of the clients come from Helping Hands, and we're happy when they come.
And I'm going to add to that. I think that as we had discussed too, some of the more formal arrangements that we've seen come out of our meetings together, certainly like the Loft at 8 Corners with NAMI, and our presence at the living room for a time with them as well. And we also do work with each of the agencies with Age Options. We work with Aging Care Connections. We will be probably working a little bit more with Helping Hand as we develop dental care for people with developmental disabilities, and really just to hear that to hear what's going on and let those ideas germinate at the meetings when we're together is really an essential part of what we see as we look to what the future needs are.
Echoing what has been said, I also think it's important to recognize that any one of the challenges that those that we work with face never happens in a vacuum. And so for those who have certain needs, oftentimes we're looking to the other partners at this table to make referrals, to have those referrals be warm referrals. So we're doing these introductions to make sure that where we can help buoy the community in care beyond our specialty, we're really partnering to circle those who need it most in care. And so we see all these faces oftentimes at meetings and on emails and on the phone, connecting and establishing more linkages to care to make sure barriers are reduced for residents of the Riverside Township community.
I want to say I'm not aware of any particular collaborations, but CSS is also a part of the West Cook Coalition, so I'm pretty sure there'll be definitely more collaborations. Also has already been indicated at the end of each meeting, I'm there, I'm listening, so I'm taking in the resources and have definitely made some referrals to these other agencies.
For UCP Seguin, we're involved in the Community Resource Center as a partnership that was germinated and developed through the auspices of the Riverside Township Mental Health Board. So that in and of itself is a prime example of the partnership that's been aided greatly with substantive funding through the Mental Health Board. Organizations that serve people with developmental disabilities, every one of them that are represented here, know something about what is called the They Deserve More Coalition, which started some 6.5 years ago through the auspices of UCP Seguin to advocate for changes in funding, for much increased funding, and address the staffing issue that Marianne mentioned that we all have had for many, many years. Bad pay for our staff has increased over the last 7 years because of that partnership, which now includes 90 organizations across the state of Illinois, including the developmental disabilities providers seated at this table. And that's resulted in almost 100% increase in wages for the staff who deserve more, which then can help them better deliver the services to the people with disabilities we all serve. So having that opportunity through the township meetings, mental health board meetings, we have that continued communication flow that strengthens that effort.
Just to add on to that, the collaboration with Way Back In, UCP Seguin, and Aging Care Connections through the CRC and because of the CRC has also led to what's become an annual health and wellness fair. So we do collaborate and work together with that. But additionally, Way Back In independently has been very fortunate to be receiving aid through NAMI because they come on site and meet with our clients to help them locate jobs, because part of what they do when they are, as we say, rebuilding their lives, is that they do have to start from the ground up and figure out how to live in the day-to-day as a quote-unquote normal person. And because of resources and that connection like NAMI, which has been, again, just an absolute asset, cannot stress how phenomenal it's been. I've been waiting to say that.
It's good.
That's been crucial. That's been very beneficial, and we are very appreciative of that happening for our residents. So thank you for that, and thank you for helping to establish these collaborations.
In preparation for a in-service for all of our staff, we sent out a survey asking staff what kind of topics that they would like us to address during the in-service. And one topic that surprised us that came up was domestic abuse. And so we were able to partner with Pillars, and Pillars came and did a presentation to our staff answering that need. So that was another example of a partnership.
Good, good. I know we had a question earlier. Go ahead.
Yes, I'm aware that the township funds many of the agencies that work with seniors. Are there programs specifically for seniors with dementia or Alzheimer's?
Okay. So I'll go ahead and repeat the question. And the question is, Of course, the township itself, as well as the mental health board, serves seniors. But specifically, are there any programs that we have that address seniors experiencing dementia or Alzheimer's? Let's go ahead.
Oh, Joe, I was going to say, UCP Seguin serves people with developmental disabilities, but just like anybody else, they age. And as they age, many of them encounter and experience the condition of Alzheimer's or dementia. In particular, people with Down syndrome have a propensity to age, as they age, to be befallen with Alzheimer's. I can speak from my own experience, having a brother who was 68 years old, well beyond his life expectancy with Alzheimer's. He doesn't live here, but there are other people in this community that do. We have 8 group homes dedicated to senior cares, to care of seniors, including 1 in North Riverside. And that specifically is to address the needs of individuals who present that dementia or other related aging condition. So, and that the same goes for the day services, the community day services we provide to those individuals. They get treatment that is geared specifically to address those particular needs of aging individuals.
WSSRA also offers programs during the day, during the week, for individuals with dementia issues.
Good. Any other comments from our panel? Okay. If not, any other questions from our audience? Please.
No question, but a comment. I never realized how many special people it takes to take care of this village and beyond. It's amazing.
And the comment was the realization of how many people it takes to provide those support services and those services. And it's not only numbers of people, but it's also the collaboration and working together that makes this happen. And I think that's a real gift for the residents of Riverside Township. Having been all over the state and worked in different areas, Riverside Township is way ahead of the curve in a lot of this. You know it when they start consulting with, hey, you guys are doing this, we're interested. And also raising to the occasion, like with the rollout of 988. Monitoring it, reading reports, and seeing what we could do to facilitate a building of a seamless 988 response system. And of course, Pillars has the crisis response teams that will go out. And a big change will happen July 1 next year when 911 starts transferring to 988. I think that's when we'll start seeing a surge. Any comment from Pillars on that?
I have a comment on the residents' comment. As we all kind of have our nice little catchphrases that we like to use, one of my favorite ones is heartwarming and essential. And being in this meeting today and seeing the response and the commitment of Riverside Township residents and the Mental Health Board, the work that the Mental Health Board is doing is heartwarming and essential, and it really contributes. Everything that all of these organizations are doing is making your community, whether you are directly getting the services, it makes the people around you able to work, live, and be part and contributing to your great community.
Yeah. I also want to step back, being a resident of Riverside, I see in our newsletter all the services for senior citizens in Riverside. I know I'm one of them. I got my Medicare card in my back pocket, but movie nights and just a whole variety of what I call social services, really outside of the Mental Health Board, but nevertheless is something that's there and available for our residents. Any other questions or comments? If not, first of all, let's give a hand to our panel. Let's also give a hand to those who volunteer and serve on the Riverside Township Mental Health Board. And especially to our Riverside Township Supervisor, who's been a strong supporter and advocate and always there when we need her. And finally, I would like to have the board and all those presenting agencies give our audience, the residents of Riverside Township, a hand for being here. And finally, to Riverside TV for their efforts, technical assistance, and they're going to take the tape and edit it, and it'll be placed on the internet for watching. So Riverside TV and our production people here, thank you very much. That concludes our proceedings today. We have a cake in back, refreshments, and do go around to the booths. There's some nice handouts. In fact, I'm going to make them around. My pins are starting to go dry. So help yourself. So again, thank you guys.